Hey guys, I've got D for you. It's extra tonight. Kidney failure and end stage renal disease, or ESRD, occurs when kidney function at less than 15% of normal capacity and can lead to serious complications like heart disease and stroke if untreated. There is no cure, but treatment can slow progression, reducing complications and extended life. Treatment options, depending on the underlying cause and risk factors such as age, efficacy, and smoking status. The three primary approaches are dialysis, replaces part of kidney function by removing waste and excess fluids. Kidney transplant offers a potential long-term solution for eligible patients. Conservative management, opting not to use dialysis or transplant, focusing instead on quality of life and symptom management. It's a helpful overview for anyone exploring options after a diagnosis. Would you like to delve deeper into uh, comparative pros and cons of each approach, especially around quality of life outcomes? That could be especially relevant if you're thinking uh, systematically about patient-centered care. Great question. Dialysis is a life-sustaining option for people with kidney failure, but it comes with a complex mix of benefits and trade-offs, especially when you're weighing through the you're weighing through the lens of a quality of life and long-term care uh, planning. Life extending. Dialysis replaces crucial kidney functions, filtering waste and excess fluid from the blood when the kidneys can't. For many, it's the bridge that keeps them above. Symptom relief. It can significantly reduce symptoms like fatigue, nausea, and fluid overload. home-based options. Peripheral dialysis and home hemodialysis can offer more flexibility, independence, and privacy than in-center treatments. Not dependent on donor availability. Unlikely transplants, dialysis can start relatively quickly. Doesn't rely on a matching organ. Cons: these time and lifestyle demands. Traditional in-center hemodialysis usually requires sessions 3 times a week, each lasting about an hour. This can disrupt work, caregiving, and daily routines. Physical toll: fatigue, low blood pressure, and cramps are common side effects. Long-term dialysis can stress the cardiovascular system and other organs. Environmental strain: depression and anxiety are not uncommon, especially as patients cope with chronic disease and challenges in independence. Cost and access: while Medicare often covers dialysis in the U.S., managing out of pocket costs, transportation, and access, especially in rural areas, can still be challenging. Not a cure. Dialysis manages symptoms but doesn't stop disease progression or restore kidney function. For patients, prioritizing autonomy or weighing end-of-life quality conversations, conservative management, or treatment, many feel more aligned. Would you like to compare how outcomes differ across these choices? Maybe even zoom in on how prevent reported satisfaction varies among different treatment paths that might resonate with you. Your focus on person-centered care strategies. There are 2 primary alternatives to dialysis for people with end-stage kidney disease. Each offering a distinct balance of benefits, risks, and lifestyle implications. Kidney, kidney transplant. Pros: can restore near normal kidney function, often improves quality of life and longevity compared to dialysis. Frees patients from the time and physical demands of regular dialysis sessions. Cons: requires a suitable donor. Waiting times can be long. Lifelong use of immunosuppressive drugs to prevent rejection, which carry side effects and increased infection risk. Surgical and post-op risks, especially in older adults or those with other health conditions. Transplant is generally the preferred option for eligible patients due to its long-term benefits, but eligibility criteria are select, conservative management. Pros: focuses on comfort and symptom control and end of life rather than life sustaining. Life extension. No invasive procedure or hospital visits. Care is often home based and palliative in nature. Okay. Supports more natural progression of kidney disease aligned with some patient values or advanced age. Cons: does not replace kidney function, eventually leading to death. Many require difficult conversations around end of life planning. Still involves managing fluid overload, anemia, and other complications of kidney failure. This option is often under discussed, but it can be compassionate and dignified path, especially for older adults with complex comorbidities or limited life expectancies. Given your interest in person-centered care and systematic care. Challenges. It's worth considering how these choices interact with autonomy, family dynamics, and care planning. I want to delve deeper into how different models like self-directed palliative support could be integrated into these pathways that could open a whole raw angle suitability for conservative management in end of life, end stage kidney disease depends on a balancing clinical realities with the person's goals, values, and overall life content. Here are the main factors typically considered. Overall health status, multiple comorbidities like heart failure, dementia, or advanced cancer may make aggressive interventions like dialysis more uh, burdensome than beneficial. Frailty, and poor functional status often shift the focus toward comfort and quality of life, patient values, and preferences. Some individuals prioritize staying at home, avoiding hospitals, or maintaining autonomy over extended life at all costs. Cultural beliefs and prior experiences with chronic illnesses often shape this preference. Age and life expectancy. In older adults, especially over 80, the survival advantage of dialysis may be modest and offset by treatment burdens. A limited life expectancy due to other conditions can make conservative care the more compassionate route. Cognitive function. Moderate to severe cognitive function impairment can make dialysis adherence difficult and reduce quality of life during treatment. Family or case team often helps assess the ability to participate in complex care routines. Support systems and resources. Lack of reliable caregivers, transportation, or access to dialysis centers may limit practical feasibility. Okay, guys. So that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.